Stop saying you're antisocial because you probably don't mean it. Welcome back to the ACS Mental Health Counseling YouTube channel. My name is Adam Schwartz. I'm a licensed mental health counselor in New York. I specialize in anxiety disorders, men's issues, and relationship coaching. Welcome to this, my series of psychoeducational videos on all things mental health that I find interesting and that you hopefully will find useful. Today's topic is a bit of a pet peeve of mine, of which I have many. You can ask my wife, she will confirm this. She has to hear about it. When I hear perfectly well-adjusted people describe themselves as antisocial, I have to fight the internal urge to correct them. It's usually a fight I win, which is good, and we'll come back to that point later in the video. But this is an interesting topic having to do with diagnostic labels, the colloquial or common use of language, and how misuses of language can actually result in new definitions. So what do people typically mean by antisocial? Typically, well-adjusted people, when they tell you they're antisocial, mean to say that they're shy or they're introverted or maybe that they're asocial, which is not much engaged in social activity. This is very different than the clinical diagnostic label antisocial, which is used to describe someone who lies, cheats, steals, and is maybe even violent at some point in their adult life as a persistent feature of their personality. In fact, antisocial personality disorder is the diagnostic label that we use for psychopaths and sociopaths. So how did this confusion come about? I think it's pretty straightforward, actually. I think people are confusing the word asocial with antisocial. The prefix a means not, which is an accurate description of someone who is not much engaged in socialization as a result of being shy or introverted. The prefix anti means against, which is also an accurate description of someone who is flouting healthy, normal social conventions by lying, cheating, stealing, or being violent. So the two words are pretty close phonetically. The difference is nuanced etymologically, but functionally, of course, they're miles apart. So it's an interesting linguistic phenomena how these misusages can actually transform into a new definition. In fact, if you go to an online dictionary, you'll see these two different definitions listed sequentially for the term antisocial. The older definition meaning criminal or psychopathic or something along those lines, and then the newer definition being introverted. So you can see that change actually happening in real time. It's much like the word literally seems to mean something different than what it used to mean, which is something you probably noticed. It used to just be a word that denoted the non-figurative use of an expression. Now it just seems to be used as a general intensifier. And this is actually another one of my pet peeves. But to shift this back to the world of mental health, I'll leave you with this parting social tip. Don't correct people in real time on these matters. By all means, if you have a YouTube channel, rant about it, but don't correct people for misusing words like antisocial or literally. There is very little social upside. Just let it be, and you just don't want to be that guy. That being said, next time you're tempted to claim that you're antisocial, think to yourself, is this really the label I want to use for myself? Is this really what I mean? Because it probably isn't. And if it is, you're going to want to work on that. All right, all the best. I'll see you in the next video.